Okay, it's just preparing to live stream. Okay. And sorry, it's just a little bit of a process. Okay, go live. Oops. Sorry, guys. Go live. Okay, it's just hooking in. Great. We are live. Thank you for joining us for this special World Haemophilia Day webinar on resilience and adapting to change, career, work and sport. It was World Haemophilia Day last Saturday, the 17th of April. The day is recognised worldwide to increase awareness of haemophilia, von Willebrand disease and other inherited bleeding disorders. This year's theme was adapting to change. Living during a pandemic can pose many challenges, not only for our health, but also for our mental health and well-being. We are lucky to have the following speakers tonight. Penny McCarthy, clinical nurse consultant at the Ronald Soares Haemophilia Centre, the Alfred, Victoria. Hayley Coulson, physiotherapist at Lady Cilento Children's Hospital in Brisbane. Nicoletta Crellini, haemophilia social worker at Royal Prince Alfred Hospital, Sydney. And Darren from Victoria, commonly known as Crouchy at his HTC. He's one of two boys in his family, but the only one with severe haemophilia A. He's 29 and passionate about his career and enjoys spending time camping and modifying his four-wheel drive. So let's start. I'm going to hand over to Penny first.
Hello, thank you very much for having me tonight, and happy World Haemophilia Day to everybody. And it's such an interesting time to be talking about adapting to change, because I think last year with this pandemic, I had more change in my life in one hit than I had in my 40 plus years of nursing. If you live around a hospital long enough, we live in a very fluid environment and our days change quickly from day to day. And a lot of that revolves around the people we look after, because everyone's different, to try and make them feel comfortable and address their needs. So for young men with haemophilia, or anyone with a bleeding disorder, girls as well, but one of the first big transitions, big changes you have is when you transition from your paediatric hospital to your adult hospital. And it's such an unusual time. It's an exciting time because you've finally finished school. Usually you've done VCE, you may have your driver's license, you've got a girlfriend, mate, you've made it. And suddenly mum and dad are going, darling, you're not grown up yet. I don't want you to go over there. It's a big wide world of the adult hospital. At our place where there's no, meerkats or playgrounds or Maccas or, all the good stuff that goes with the children's hospital. So you arrive and, we've a whole new team, and often an adult centre has a much bigger team, and that's because we have you from when you get and I'm sure this is the same in all the states, we have you from when you turn 18 to when you at the end of your life. And our oldest patient he didn't quite make 100 last year, or the year before pandemic. We lost him at age 99. And so we have you for a long time. So our team's much bigger. You've got, in our team, we've got 5 haematologists, 3 nurses, 3 physios, 2 social workers, a psychologist, a rheumatologist. The team just goes on and on. It's enormous. So there's all these new faces and a place you don't want to be, that you're not familiar with. So it's a really big time for change, and it can be quite daunting. And, you don't know how you feel about it. We don't know how we feel about you. And it's a time when we're asking your parents to step back, and with different relationships form. We're treating you as an adult. And, we're so used to young men turning around and saying, oh, ask mum, going, yes, we will ask mum, but we're actually asking you, do you know the name of your treatment product, or do you know how oftentimes treated? Oh, ask mum. No, we're asking you. So the ways we work are quite different, and it can be just very daunting. And how you adjust that, everybody does it very differently, and we're all there to support you along that time. Now, during your lifetime with the bleeding disorder, you'll find that the treatments change. And why that is frustrating for some and exciting for others, for example, when I first started in this role, I've been in this job for a very, very long time, that we only had one treatment for haemophilia A, we had no treatment for haemophilia B, and as the time's gone on, the treatments have changed. Now, a lot of these changes, you think, well, I want that new treatment, or I want to do this, or I want to do that. A lot of these changes, or I don't want to change, but a lot of these changes are out of our control. We can put a lot of input, and certainly the Australian Haemophilia Nurses Group, and the physios and the social workers put a lot of input, and the Haemophilia Foundation, into what treatments we would like. We see what's on the market, but it's our funders, the government, the National Blood Authority, who we work very closely with. They go through an enormous consultative process, and they will give us a suite of products, of treatment products to choose from. And that can be great, and it's all, but sometimes they want us to change quite quickly. So we're a bit stressed, and then we're saying, and as Crouchy's been part of this, oh, we need you to change products next week. That kind of moving on. We're not having that product anymore. We've got a new one. And so it's all daunting, and it's more appointments. We need to come to hospital. But in saying that, there has been some exciting changes that came along. We went from plasma-derived products to now the safe recombinant products, and now they're very exciting for those that are eligible to use it, Hemlibra, which is the subcutaneous treatment. And we've got other treatments that are on trial. And certainly at our centre, we try to give you as much choice as possible. And that can make life even harder, because sometimes, you're thinking, oh, I just want someone to tell me what to use. And we say, no, the choice is yours. And choice can only happen, and change can only happen smoothly if you have as much education as you possibly can around the change. And we try and share with you why changes are happening, or that can be around treatment product, can be around appointment times, it can be around the team members you see. But, when you've got the information, you're there, you can help, very much the team effort to make good choices, and and adapt to those changes. And so you kind of wonder, okay, we have over 1,000, oh God, no, probably 1,500 people registered at our centre with bleeding disorders. And how do we look after you? I mean, we can't see you all day to day. In fact, from a nursing point of view, if you came and saw me 3 times a week, and we used to have people queued up the doors for their treatment 3 times a week, we had no home therapy. That was really easy, because I could see you, I could look at you, I could talk to you. But we're doing it from afar now. But the best thing that's, one of the positives that came out of the COVID is the changes. We have proper telehealth now. So I can look Crouchy up, and I can look him in the eye and say, mate, how's it going? For a long time, we've been trying to keep up with technology using SMS messaging, so we don't actually have to talk to you, and you can answer our messages in real time, in your time, not our time. But the other thing, to monitor you from afar, because seriously, what young person wants to come and visit us? You've got better things to do. So we certainly at our centre, we rely very heavily on the ABDR, the My ABDR. You fill in yourself. For people who treat themselves at home, we ask you to fill that in. And it's so interesting what we learn from that. So for someone that's had really good recording patterns, every time, every week, their records are all up to date. We check these twice a month, all up to date. We go, oh yeah, they're cruising along. And suddenly we see breakthrough bleed, breakthrough bleed. We contact you. We say, hey, what's going on? What's with that ankle? Oh, yeah, I've started playing footy again, or, oh, I can't be bothered doing my treatment, or there's so many things. And so we bring you in, or we get a physio to contact you, or the doctor, or whoever, whatever. But the other side of it is we see someone who's been doing great treatment records, and all of a sudden they just stop, or they're intermittent, or needing lots of reminders. And we go, hey, what's going on? And they're going, we've just had a baby. We've got no sleep. We're sleep deprived. We need help. We can't do this. So for lots of reasons, change of behavior is how we can break into your lives and say, hey, you know, how can we support you? What's out there? You know, change. I mean, there's always a change coming from our end, but the change in your life is huge. And, you know, you go from, you know, school to university to get your first job, to you might be able to do 2 jobs, you decide to buy a house, so you're doing 3 jobs, you get a baby, a dog, whatever. You know, it really, really can make life that, you know, you're trying to adapt to the change going on in your life, or COVID, as well as what's going on in our world. And we try and get those two to join together. Sometimes it's not as smooth as it could be, but we do try very hard. As you get older, you know, as I said, you know, I met Cratchy when he was 18. How old are you now? What, 28 or something? You know, we're working with him, but his life's changed so much. And we have to adapt with him to make life work for him as well. And then you get older and older and older, like old people like me. And, you know, other things start happening. You might start getting, you know, a bit of, you know, hypertension or things of aging, you know, rotten joints or things that come with getting older. And we have to adapt around that and make your life work with you to make life as most comfortable. So on the whole, what we like to do is we keep you at an arm's length, so we really don't have to see you, drag you in. But we need to see anyone with severe haemophilia or anyone's treating at home at least once a year in person. Now COVID's over, just once a year. The rest we're managing by video calls, telephone calls, things like that. And certainly, you know, at times of, if you need operations or something's going on, or, you know, we will see, we're happy to see you. But seriously, you know, with all this change going on, if we can keep you out of hospital, our role is to keep you away from us, not near us. But we like to do it at an arm's length. So we're in our little fold, but we like to know who our patients are and get to know you. And what's so weird is that, you know, I meet you at 18 and I may not see you again for some years, and growing a beard or you're wearing a mask and I just don't recognize you, and that's really scary. But everyone's changing, as you don't recognize me. But look, it's just a tough time, but we've all struggled through last year. We've made it. We've come out the other end, and everyone's doing very well. But certainly stay in touch with the Haemophilia Centre and call us when you need us. And just to let you know, we are there to help you go through any change, whether it be a treatment regime or a personal change in your life. So, yeah, it's lovely to meet you all.
Thank you, Penny. Hayley, I'll pass on to you.
Thanks for having me as well. So I'm going to just talk about exercise and injury, and just how, you know, working with your body for working as well when you get a job, just a bit on that. So regular exercise is a good thing, and most people do know this already. There are many positives, such as social interaction, emotional changes, reducing stress, improve muscle strength, control. You can get stronger muscles, which do support your joints. And this can actually reduce joint pain as well. There's improved flexibility, as well as preventing long-term issues such as heart disease, obesity, high blood pressure, and osteoporosis, which is weaker bones. People with bleeding disorders may be anxious about sport or exercise, thinking that they will have bleeds. They don't really know where to start or what they should do. This is where looking for ideas or advice is really important. There's so much information on the internet. You can Google things. There's so many reliable websites that you can get advice on exercise. But otherwise, seeking advice and guidance from your haemophilia treatment centre or the foundation is actually a good place to start. There's also the option of talking to older people with bleeding disorders or somebody of similar age and get their personal experiences in this area. But what are the things you would do if you have an injury? So it's always important to rest. You can even use ice. If you have regular joint bleeds or muscle bleeds and you know that, then not walking on the leg is very important for recovery. If you have an injury, you should carefully monitor it. And if you're unable to walk normally, or if there's noticeable swelling or limited range in that arm or leg, then you need to ask for help. And that's where you contact your treatment center, your local hospital if you're not close to a treatment center, or your regular physio to have a review. Ignoring your injury and not looking after it could impact you in the future and long term. So you want to try and play a sport and you're thinking, what should I do? Before beginning participation in a sport, if having an evaluation is helpful to review your joint motion, your muscle strength, your flexibility and ligament stability to see what sort of sports may be higher risk for you and your body, because everybody's different and some sports might be appropriate for some and then not good for others. Contact sports or high risk sports like boxing and rugby should be avoided or considered very carefully and discussed with your treating doctor. Protective clothing and protective gear is really important when you're doing sports like cricket, hockey, if you want to do motocross. And there's something called the Bruce Activity Calculator, then that can be accessed online. So you can just Google Bruce Activity Calculator in haemophilia. And that's quite a good one because it can help you assess the risk when you want to start a sport. It grades them and it also takes into account your level of your bleeding disorder as well. So if you do have a job and it is getting a bit hard on your body and you're wondering, what can I do? It's quite important initially when you are deciding on a job that it works with your bleeding disorder. Knowing how long you will be working for in your lifetime and having a job that doesn't place a huge amount of stress on your body is important. So physical jobs without rest can be quite hard. Also, depending on your job, your relationship with your manager or your boss is quite important. You can ask for changes to your role. So for example, if you're working packing shelves at Coles and you're finding your ankles and knees aren't coping with the bending and the lifting, maybe changing to customer service counter can make things a bit easier. Or if you're actually unable to change roles and you really love your work, it might be worth focusing on your strength and your fitness and seeing if this can help you carry out your role a bit better. There are lots of people who can support you, your fitness journey, your job, your role. So along with the haemophilia treatment staff, there's a lot of other people outside of that, like experienced exercise physiologists, personal trainers, and they can also provide guidance around your strength and exercise so that you can function throughout your whole life as best that you can. Thanks.
Thank you, Hayley. I was just Googling the Bruce calculator.
Okay.
So we have found it and it's gone onto Facebook. So thank you.
Oh, thank you.
Thanks for that. Nicoletta, over to you.
Hi, everyone. So I'm going to talk about mental health and adapting to change. So looking after your mental health is very important, and it's something that we always need to try and keep check of throughout our life, as life isn't a perfect journey, and particularly for young people. I guess there's so much that's happening in your life that you're trying to work through, if it's study, new jobs, relationships, family, body image stuff, health concerns, and even changing your treatment center. So one of the most helpful ways to look after your mental health is to identify the people in your life who you feel comfortable talking about what's happening in your life with. And these people are people that you feel that you're able to be honest and open with, without feeling judged, that you can talk through these changes in life, not just the triumphs, but also the challenges. And so these people are kind of known as social supports. And so social supports are people like your parents or your family, your siblings, cousins, your friends, so people that you've met, through school, study, sporting groups, even through the haemophilia foundations as well, and your colleagues. So the important part of talking about your mental health is that it's a way through talking with your social supports that you're helping yourself. You're getting the opportunity to let out what's going on in your mind, what's worrying you, what your concerns are. And you also get the opportunity to then get support from those people and get advice from them. And it's advice from people that you trust and that you love. Then you can also be helping them. So talking with people, you never know what's going on in their life. And so it's also an opportunity for you to talk through what's happening and support them through their own issues as well. You also have those of us that work at the Haemophilia Treatment Centre as well. So you've got your healthcare professionals and there's those of us there that, like myself in my role, are there to talk through what's happening in your life and provide you with support and guidance and link you in with the appropriate supports that might be able to help you with your journey and your challenges. Then you can also access support through your GP. So if things are starting to get quite concerning and you're worried about what's happening, you can link in with your GP and they can connect you with the appropriate healthcare professionals that might be able to work with you longer term through your mental health concerns. And then there's also a range of online supports as well where you can seek out support or contact support. And I know that Tash will post that up online or in the chat. I've put together a couple of numbers to contact if need be. And so I guess looking after your mental health is also a way that helps you adjust and deal with life changes. We've kind of touched on the fact that change is an inevitable part of life. Sometimes we get the opportunity to make the decisions around those changes. So it could be, that new job or the new studies that you're embarking on, or even the new treatment changes that you're considering to take up. And to help with these type of changes, it is important to speak with those social supports and those people that you trust, and also to speak with the professionals, at the Haemophilia Treatment Centre. So, your nurses, your haematologists, your physiotherapists, your social workers, to help you in making informed decisions. You can contact or speak with the haemophilia treatment staff about treatment changes. And you can also talk with your prospective employer about the job that you're interested in, or you can contact the education facility like TAFE or university to talk about the course that you're interested in studying in. So I guess the point is that you're always in a position to talk through what changes you are considering in your life and make really informed decisions around those changes when you have the opportunity to do so. Then there's also changes that we cannot prepare ourselves for. For example, I guess 2020 and the COVID-19 pandemic is a great example. I don't think any of us saw that coming. And so for these type of changes, we actually need to tap into, I guess, a sort of invisible armor that we've built up over time. And this invisible armor can be things like resilience. So resilience is the ability to kind of lift ourselves up when we've been knocked down by something that's kind of hit us for six. And how we tap into resilience, one of the ways is kind of looking back at how we've overcome past problems and how we've dealt with those issues to then help us and inform us to work through the current challenge or issue that we're dealing with. So, it could be in the past that you've talked through these issues with friends or family members. It could be that you've also, accessed things like taking a bit of time to reflect back on what's happening and just, thinking about how you're going to process and proceed with the situation. It could be also through, self-care and taking a bit of time or engaging in rituals that, help you look after yourself and relax, both physically and mentally. So it can be things like going outside for a walk, watching trashy TV, even playing your favorite video game or whatever it might be. So dealing with change, I guess, is knowing also about when to seek support. So if things get a bit too much, talk to your social supports, visit your GP, or even contact us at the HTC, because people do care and we most certainly are here to support you. And that is all from me. Thank you. Over to Crouchy.
Thank you, Nicoletta. Okay, Crouchy, over to you.
Yes, hi everyone. Thanks for having me tonight. Hey, HFA. It's a pleasure to be a part of this and happy about change. As discussed, I'm 29 and going on 30. I'm dreading that time in mid-year, turning the big 3-0. But one of two boys, so I'm less than 1%. It was a bit of a shock to the family when I was diagnosed. Has it stopped me? Definitely not. I'm a fully qualified mechanic, been working in the heavy diesel industry for over 10 years now. I worked 2 jobs when I was younger. I've travelled overseas all through Vietnam and through Thailand as well with my medication, which is massive. Taking that product overseas has its challenges, but I mean, Penny's touched on the support that they offer. It's huge. Communication is key. She's bang on the money. Like, they don't want to be dealing with mum and dad. They want to be dealing with you and your partner and who you choose to be with and look to be with for the rest of your life. So that's huge. You are 100% in control with whatever you want to do within reason. I rode a motorbike every day for about 2 to 3 years up and down the Monash Freeway in Melbourne, and as much to Penny's disgust, it was not a problem. I snowboarded all through winter as well. So there's multiple things that I've done that just has not let me hold you back. But how you support that and how you articulate yourself and move forward, that is all on yourself. There's been multiple points raised tonight about, the appropriate PPE, like make sure you're wearing all your safety gear, make sure you're not snowboarding down Mount Buller with no helmet on. Like, I water skied with mum and dad when I was younger, and mum and dad made sure I had my helmet on and I had all the appropriate things. Like, it's just really, really channel those outlets that you have, I suppose, and your support from your family is huge. My girlfriend's probably one of my biggest supporters now, and still mum and dad are my supporters, but I'm in control of it. So that's probably a big thing. Your employer is huge. Really just be open with them. That's probably the best advice I can have. My employer is probably one of the most supportive companies I've ever seen. They just be open with them. Like, the old theory that you're going to get a cut and bleed out and die on them in sort of the lunchroom, it's not a thing. But it's a whole bunch of, it's not aware. The awareness is not there. The education of haemophilia and severe haemophilia is not out there. Your diabetes, your cancers, your epilepsy, that's also commonly known these days. But haemophilia being so rare, it's just the support or the education for the employer, it's not that known. So I think the big thing there is just be open about it. Don't hide it. It's nothing to be ashamed of. Like, it really is. I live a normal life, like absolutely 100% a normal life. I've done multiple trials through the Alfred, and there's been some really good ones come out of it. I'm on one now, and it's a fantastic trial. I did their half-life trial originally, which was perfect, extended half-life. That was really, really good. So yeah, there's some really, really good things that can come out of it. Penny touched on when you transition over, it's a big, scary world. It's not that scary. It's just be open, just be yourself. The My ABDR app is probably one of the perfect things for record keeping. If you can log on Facebook for an hour a day, you can spend 2 minutes putting your diary into your phone, recording it. I was terrible at it, and Penny would be forever on the phone. And that soon changes because you learn that, again, for that simple thing, it's communication, and they'll be on you. And if it's not Penny ringing you, it's damn sure it's Megan. So God bless their cotton socks, I tell you. The other thing, Nicoletta was talking about friends and family. Look, really, really focus on that. Don't let your friends get you down about it. If your friends are saying you're never going to work, you're never going to get a job, get new friends. Like, it's really, really find the people that push that positive and support you. And yeah, I just think we need to focus on those things. Don't be scared of change. Just look at how you can target it, how you can overcome it. Really is probably a big thing. I've done multiple things. I've worked in field service, worked remotely, worked on big major events within Melbourne. But again, just knowing that your treatment plan is key. If HTC or your haemophilia treatment centre give you a treatment plan, just stick to it. You will be at predominantly normal levels according to that medication that you're on, and just don't be silly. Like, if you fall over, make sure you medicate yourself. It's really just key, simple things. But yeah, like I said, I have no problem with change. I'm open to questions too if people want to field questions my way. Penny's said, there's a lot of people ask about tattoos. I'm covered in tattoos. I have multiple. My arms done. I've got my chest done. My legs are all done. You can do it. Just make sure you notify your tattooist. It's not a problem. But yeah, I don't have them on my neck or anything. I'm not that crazy. But you can get them. You can live a normal life, but just be cautious. Be very aware of how you do it. There's not really much else. If there's any sort of questions, I mean, please send them my way.
I do have a few.
Yeah, please go ahead.
Question from me. When you decide you want to get tattoos, you say speak to your tattooist. Should you speak to your nurse first or your HTC first? Is there anything special you need to do with them as well?
Well, you want to you would obviously consult the nurses. That will tell you they're rightly against them, but that is okay. But yeah, you should, because you want to make sure you're maintaining your appropriate clotting factor levels, and you don't want to be doing your treatment just to get a tattoo. It's not what it's there for. Don't be dosing yourself and having your factor just to go out and get a tattoo. It's not what it's there for. Make sure you're on your Penny.
Yeah, can I just, our line on that one, our company line on that one is we don't condone tattoos. However, if you are going to have them, please have them on the day of your prophylaxis. If you're someone that treats at home, if you have mild haemophilia, you should be fine. But as I said, we don't condone tattoos. Crouchy, just give us a flash of one of them. Come on, just show them you do have tattoos. There you go.
It's definitely a thing.
He's not making it up.
No, they don't come off in the shower.
Question from Facebook. How did Crouchy's parents support his earlier years of doing normal boy things?
Yeah, great. My mum's aged very, very well for the normal boy things that I do, and the punch-ons and the arguments my brothers and I used to have was fantastic in the Crouch household. How do they support it? It's just, boys will be boys. Like, how do you control what they do? If they want to kick the footy and then have a swollen foot for 3 days, it's going to happen. Like, that's the joys of having boys with haemophilia. However, they supported it very, very well. My parents had a lot to learn. My mum learned how to medicate me through the vein and do all my medication from home. So she supported it by learning about it, asking the appropriate questions, and letting me do things, but made sure I had the appropriate safety. Like, she didn't don't wrap me up in cotton wool. Don't wrap your haemophiliac son up in cotton wool and shelter him from the world. It's not required. Let him get out there and experience things, but just make sure his treatment plan's up to date. Like, make sure you're medicating him accordingly. Make sure you're communicating with, the relevant, like ours is a Royal Children's Hospital here in Victoria, but make sure you're communicating with them. If he hits his head hard, well, take him into hospital, obviously. But yeah, I think the biggest thing then is don't hold them back. Support them. Give them the support they require. Otherwise, they're going to get to 18 and be scared of change and not want to do anything. So that's probably the biggest thing.
Great advice. Another question is, how do you start a conversation with a new employer?
Well, there's a couple of ways. If you're confident about it, just be open with them. When they, ask them about yourself in an interview, you can say, talk about yourself and what you do. Oh, by the way, I do have haemophilia. No, it's not HIV/AIDS. No, you can't catch it. No, I won't give it to anyone. And roll it off like that if you wanted to go in that sort of terms. Or you can advise them and give them a little bit more information about it. My famous line is, if I didn't tell you, you wouldn't know, because there is no difference. That's how I would sort of introduce and engage that with them. It is hard because every employer is different, because the employer's natural reaction would be scared. What is the liability of having a haemophiliac there? And realistically, there's none. If you medicate correctly, you have that communication and you give them that information and support back, there should be no worries.
Thank you. Okay, I have a question for Hayley now. How long waiting is too long? If I can walk, but my knee's still swollen and sore after 5 days or so, should I call you, or is it too late?
No, I think that calling, even if you have waited, that's more important than just ignoring it. You definitely need to have support, and even if the injury isn't in what we call the acute phase and it's gone into more of a subacute and chronic phase, that's okay. There's still things that can be done. You may not be having ongoing treatment, but there's lots of different things that your physio can do, and then at least you will have the follow-up advice and guidance, so that if it does happen again in the future, you know exactly what to do and you know how to manage it. Because as Crouchy said, if you don't have a lot of bleeds and you're getting on with life and you're being as normal as every other boy, then you forget about those things. But having that education and having that awareness and that knowledge is what will help you to manage them in the future. I definitely think even if you have let something go because you've been caught up, it's still important to have follow-up if it's still happening.
Great, thank you.
Touch on that. I had a massive psoas bleed when I was mid-20s, but the physio and the carry on from that, even months later, was just, they continue to follow you up as well. But the onus is on you too. Like, I've got a severe ankle joint that has just deteriorated away just to multiple bleeds, but the physios keep adding stuff to that to support. So some days, not so much now, but you go back 6 months, I would struggle to walk. Like, the physio would just keep changing and they would keep finding new things. But some days I'd ring them up and they go, well, why didn't you ring me a week ago? And I go, because I was too stubborn, yeah. But more of the point is, if you're still having the issue, they'll find a new way. There's always, there's a whole team of them. So, yeah.
And Crouch, have you ever had bad experiences from physios if you have called with an injury late? Has anyone ever given you grief or made it really difficult, or are they still approachable and helpful?
Everyone, this is what I mean. Everyone is, I've built a relationship with the nurses, so obviously it's a bit different, but they've never not helped me is the key here. They've always been supportive. Like, there might be a few, hey, next time maybe just call us a week ago, yeah, instead of now, when we could have done other things to prevent this. If you leave it a week, obviously now you've got to wait longer for that to fix yourself, right? But if you call when it's a minor injury, you might only get minor physio. You don't want to be at the major part where you now got to wait for the bleed to finish and your medication and go back on your normal routine prophylaxis and then to start your physio. You're just delaying the process. So no, never a bad experience, always helpful. But yeah, just communication's key. Thank
you both. Penny, if there is a new product, will my nurse contact me directly to talk about it, or should I call them?
Depends where you are, depends where your centre is. Certainly, if we're talking about, it's probably best to contact them and express your interest in looking at the new product. It's best to contact the centre and express your interest. For example, with the Hemlibra people, you know, we had so much interest with the subcutaneous injection that we actually had to put on a Zoom meeting for all the people interested to listen to about the information, because we couldn't just keep repeating it over and over. So we had to, and then people express their interest to us, and then we can contact them in our own time to sort it all out. So if you heard a product you think you'd like to talk change to, absolutely make an appointment with your nurse or your doctor, or probably the nurse first, and then they'll escalate it to the doctor if necessary. Yeah.
Great, thank you. You might get a few calls tomorrow. Nicoletta, this is an interesting one. Advice to parents who are finding it very difficult to let their son go. So part of the whole transition process when they've been in control for so long.
As in, like, they've moved to the adult treatment centre, or they've become adults, I guess, in the health world.
Yeah.
I think it's just, about sort of opening up to it. I mean, we at RPA, we definitely aren't discouraging of parents coming to a certain extent. So come to an appointment, meet the team, get to know who we are, get to see what we're like and what we're about. And then I think that develops the trust in the centre, and it also, the parents get to see their child, I guess, or their adult child engaging in their treatment. And in some ways, for us, it's about, putting your child, put their contact details forward and not yourself, or be CC'd into emails so you can have some sort of connection. But, you're not going to be around forever. So setting up a good foundation for your child to sort of manage their life themselves means that they can, move forward and move on with their life, with confidence in accessing their treatment. So I don't know if that's the best advice, but I think it's about maybe getting a bit of a taste and then stepping away, or, stepping in when you feel like you're worried about something, because, we want to hear about that stuff too. So that's important. I don't know if Crouchy or Penny, any other suggestions?
Yeah, it's interesting that transition year, we call it a transition year because it's a time where we're getting to know the boys and also their parents. And we rely on the parents in many ways because it depends on how that family has run, whether, mum and dad have done everything and, the boy has done nothing, or they've been more independent. But it's a transition year. So we encourage, we speak to everybody. But as time goes on, we then say, if a parent calls us and says, say it was Crouchy's mum, and she called me and she goes, I'm really worried, Darren's, he's not treating. I haven't seen him treating at all, and I'm worried that he's doing this or that or the other. And we go, the first thing we say to them, does Darren know you've called? And it's like, oh, no, well, look, absolutely, I'm going to chat to you about this, but I need you to go and let him know you've called us. And then I would contact him and go, hey, by the way, your mum just called. She's really concerned that you're not treating so often. And that's sort of, it's a real transition time. We get to know the parents. And the other side of that, we often have people coming to us and saying, how do I wean mum and dad off me? They are ready to let go. That's really hard. And so we actually have to say to them, I'm okay, I've got this. But it's really opening those lines of communication. And sometimes we have the ones where the person with the bleeding disorder does not want to let go of mum and dad. And no, talk to them. We are talking to them, but we're talking to you too. So sometimes this time takes 3 months. Sometimes it takes 6 months, 12 months. By the time you're kind of 40, we've really cut the ties, we really, by 40, we think that. So it really is very individual. And of course, every family is individual. Their needs are individual. And certainly we congratulate the parents for getting their child to the point that they're an adult and a healthy young adult and adapting. But it is hard work. It's hard for everybody. I mean, we're parents and it's like, oh, well, you know, you still want to be really involved. But we don't just go, oh, you know, it's out, you're over. It's a slow process.
Great answer. Crouchy, do you have anything to add to that?
Nah, look, it is tough. My mum still knows when every one of my appointments is, and she will up until the day. Like she now obviously communicates a hell of a lot through my girlfriend, and my girlfriend, because obviously my girlfriend's my go-to person as well now, and they communicate and compare, because I might share it with my partner, but I forget to share it with my mum, who was there for 18 years, which is another phone call. However, transitioning mummy, it was hard. It was hard for mum to let go. Like, again, my parents were massive supporters up with me until I transitioned, and it was really hard for them. But like, my mum kept every single vial in an A4 exercise book with whether it was a prophylaxis dose or a bleed documentation from 1992. Like, I still have all those records now, but some people wouldn't have that, you know. So every family's different, every support is different. But yeah, it is tough transitioning mum. But just bring her along every 6 months for the first 12 months. It's not hard. Take her out to lunch. You know, that's it.
Oh, you're a good son, aren't you?
I must say, sorry, Nicola, sorry, it's Crouchy. I must say, one of the things we find funny is some of the young men still have their deliveries going to their parents' house, and they go, so I go and visit mum at least once a month.
Cracker. Perfect.
A win-win. Well, thank you. That's all our questions we have. If any more come through, we'll field them through. I'd like to thank everyone for their time. That was absolutely fantastic. Thank you, Nicoletta, Hayley, Penny, Crouchy. And Crouchy, thank you for sharing.